If you have low levels of magnesium in your blood, a magnesium citrate tablet can help prevent and treat this deficiency. It is also used to relieve symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. Magnesium is crucial for the normal functioning of cells, nerves, muscles, bones, and the heart. A balanced diet typically provides enough magnesium, but certain situations can cause your body to lose magnesium faster than you can replace it from your diet. These situations include treatment with diuretics, a poor diet, alcoholism, or other medical conditions such as severe diarrhea/vomiting, stomach/intestinal absorption problems, and poorly controlled diabetes. It is best to take magnesium citrate tablets as directed by your doctor, and typically, the recommended dosage is once daily. It is generally best to take this medication with food to help prevent stomach upset. When taking magnesium citrate tablets, it's important to follow the directions on the product package. It's best to take these supplements with a meal to reduce stomach upset and diarrhea, unless directed otherwise by your doctor. Make sure to take each dose with a full glass of water, unless directed otherwise by your doctor. Swallow extended-release capsules and delayed-release/enteric-coated tablets whole, and do not crush or chew them. If you're taking the chewable tablets, be sure to chew each tablet thoroughly before swallowing. If you're using a liquid product, use a medication measuring device to measure the dose accurately. It's important to take this medication regularly at the same time each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment, so do not increase your dose or take it more often than directed. If you experience symptoms of low magnesium blood levels, such as muscle cramps, tiredness, irritability, or depression, be sure to tell your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience stomach upset or diarrhea while taking magnesium citrate tablets, try taking them with a meal to reduce these effects. If these symptoms persist or worsen, it's important to consult your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this medication can occur. Seek immediate medical attention if you experience symptoms such as rash, itching or swelling, especially of the face, tongue or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. As for the optimal timing and dosage of magnesium citrate tablets, it's best to follow your doctor's instructions. They will determine the right daily dosage for you and advise on the best time to take the medication. Before taking magnesium citrate tablets, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions. If you have kidney disease, it's also important to consult with a healthcare professional before using this product. Some forms of magnesium citrate may contain sugar and/or aspartame, and liquid products may also contain alcohol, so it's important to use caution if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet. It's best to ask your doctor or pharmacist about using this product safely. During pregnancy, magnesium citrate tablets should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this product. It's important to be aware of potential drug interactions when taking magnesium citrate tablets. Certain medications may not work as effectively or could cause serious side effects when taken with magnesium citrate. These include cellulose sodium phosphate, digoxin, and sodium polystyrene sulfonate. Magnesium can also interfere with the absorption of certain medications. If you are taking tetracycline-type medications, bisphosphonates, thyroid medications, or quinolone-type antibiotics, it's recommended to separate the time of the dose from the time of the magnesium supplement dose by at least 2 to 3 hours. It's best to consult with your doctor or pharmacist to find a dosing schedule that works with all your medications. Additionally, it's important to check the labels on all your prescription and non-prescription/herbal products, as they may contain magnesium. Be sure to ask your pharmacist about using these products safely. If someone has taken too much magnesium citrate and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include a slow heartbeat, severe drowsiness, dizziness, confusion, muscle weakness, and loss of consciousness. When taking magnesium citrate tablets, it is important to keep up with any necessary lab tests or medical appointments, such as checking your magnesium blood levels and kidney function. It's also important to consult your doctor for more detailed information. There are different forms of magnesium supplements available, each with varying amounts of magnesium. Some of these are available over the counter, so it's a good idea to ask your doctor or pharmacist for guidance in choosing the right product for your needs. In addition to taking the tablets, it's also beneficial to maintain a well-balanced diet. Including foods that are high in magnesium, such as avocados, bananas, beans, whole grain cereals, green vegetables, and nuts, can help support your overall magnesium intake. As for the daily dosage and optimal timing for taking magnesium citrate tablets, it's important to follow the guidance of your healthcare professional. They can provide personalized recommendations based on your individual needs and medical history. If you forget to take a dose of magnesium citrate, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. Remember to store your magnesium citrate tablets at room temperature, away from light and moisture. It's important to keep them out of the bathroom and out of reach of children and pets. When it comes to getting rid of expired or unused tablets, don't flush them down the toilet or pour them into a drain. Instead, consult your pharmacist or local waste disposal company for the proper way to dispose of them. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.